Hi, good evening, everyone. Thank you for coming tonight. My speech will be regarding the consequences of non-vaccination in children. As we all know, as parents, this is one way that we protect our children. It is very much available to us. Even our government are very capable of giving this type of medications even for free sometimes to those who are less able to get them on their own. Um, there are so many diseases out there that can be prevented with the use of this type of vaccines. Let me tell you a story, which was a personal experience for us and my family. Back in December, as you would recall, there was an episode or incident of measles outbreak that had started among the visitors of Disneyland. So it was a great concern for us because we and the kids were at that park during those times that this outbreak had happened. So, and on top of that, when we came back home, one of our youngest child, developed some type of sickness. He was having some fever and he was weak. And so we were really concerned with that and the news that was happening, that there were some outbreak there. And so we went to the doctor. It turns out everything was fine, luckily. So let me tell you a brief definition of what vaccine is. Okay, a vaccine is a biological preparation of killed or weakened antigen of a disease, and a vaccine would include, the measles vaccine, the flu shots, chicken pox, and even polio, and there are so many others. And what an immunization is, this is the process of giving the vaccine and for your body to be immune to the system. What happens is you receive the vaccine through immunization, and then your body, what it will do is it will create its own defense, develop its own immunity to the antigen. The antigen, it could be, the polio, chicken pox, or the flu, even the flu. So that's what it is. It's not an active virus or disease that you will get. It's a killed and weakened antigen. So when it's introduced to you, your body will adapt and make its own type of defense to protect you when you get exposed again to this disease. So let's start by, let me tell you a little background about myself. I've been an LVN for over 9 years now, and part of my job as a nurse is I give patient education to a lot of the patients. And this topic was interesting because a lot of times when it's time for them to get some type of vaccinations, they always ask, why do I need it? Why I don't really need it. They have a lot of or what do you call that? A lot of wrong information that they get from TV or from other people. So it was interesting for me to do this research so I could provide them more information. Also, I'm a parent of 3 young kids. Being a parent, it is important for us to protect our child, and it's good to know this type of stuff so that we can share it to other parents that are misinformed. So let me start with the first part of my speech, which is the misconceptions about vaccinations. According to the CDC and WHO, there are 6 misconceptions about vaccinations. So number 1 would be improved sanitation and hygiene over time has contributed to eradication of diseases even before vaccines were introduced. So a lot of people believe that, but it's not entirely true, although the improvement of our health is impacted by this. It's not totally about that. Even with the improvement of nutrition, improvement of antibiotics, improvement of living conditions, it is still proven that vaccination is needed for us to be totally protected from this type of diseases. Next is the majority of people who get vaccinated get sick. It is true in some way. CDC explains this in 2 factors. Number 1, no vaccination is 100% effective. Okay, so it doesn't mean that once you get the shot, you're not going to get sick. It is never 100% effective. That is according to CDC, which is the Center of Disease Control. Number 2, in a country like ours, vaccinated people greatly outnumber those who have not received immunization. So it's like what I said earlier, not everybody develops immunity. So if people get sick, most of those people who get sick are also those people who had the vaccination. But then you have to take into consideration that only small amounts of people are refusing to get the vaccination. So the statistics will never be accurate in regards to this issue or in regards to this misconception. Number 3, there are hot lots of vaccines that are more dangerous than others that parents should check. This has a simple explanation because the sizes of let me explain what a lot is first. Lot is how they track the vaccines. It's called lot numbers. So every vial of vaccines comes with a lot number, and that's how they keep track of it. So the way they distribute the vaccines, it comes in different amounts. It could be through hundreds of thousands, or it could be through millions. So just think about it. If the vaccine that you got is from those who's from shipped from millions of numbers, so of course the numbers of side effects from that will be reported from that will be greatly from the lots that are just shipped for a number of thousands. Okay, so but even with that, vaccines that we get that are released by these distributors are strictly mandated. They are checked, rechecked, and they will not even be in the market if they're not unsafe. So CDC and WHO, which is the World Health Organization, are a big part of regulating this type of medications for us. Number 4, vaccines causes many harmful side effects. Vaccines are very safe for the most part. It only gives us minor or temporary side effects. It could be in the form of soreness or fever. But also there are very rare instances of some people who will develop a more serious adverse reactions, but they are so rare that even the CDC is unable to provide enough study about it because the occurrence is so rare. Okay, so as responsible adults, we have to think about the risk and the benefits. So with vaccination, right? The serious side effects comes in numbers like 1 per 1,000 or 1 per 1 million. So think about that. Think about the risk versus benefits. It's like you're saying that you can save 1 million kids, and then one might have a reaction, but what about those 1 million kids that you would save from this type of diseases? So yes, there is risk, but I think the benefits greatly outweighs the risk of getting vaccinations for our children. Number 5, vaccine preventable diseases have been erased, so there is no need to keep vaccinating. It's true that vaccinations has greatly reduced the number of occurrence of these diseases, but they might still be available in other parts of the world. Like most of you know, a lot of this diseases that we don't see here anymore is more common in the Philippines, right? So you have to think about when you travel or when you meet other people from other countries. So you can't say that this disease is no longer here because you're still at risk of getting it from other people that are from other country or that are sick and they do not even know that they are sick. Number 6, giving a child multiple vaccine at the same time puts a child at risk for harmful side effects and stresses the immune system. So yeah, when we bring our kids for immunization, we get worried that they're getting too much shots. This is actually a study had been done about this in 1994 from the Institute of Medicine in the U.S. They made a study that even when a child receives multiple antigens at the same time, it doesn't hurt their immune system. Okay, so that's a proven fact that it doesn't hurt their immune system. In fact, there's a study that they're doing right now that they want to combine more antigen diseases in one vaccine. So it will lessen the stress that it puts on a child. So they're trying to come up with a vaccine that will just have multiple vaccines for a child to get immune as early as possible. So moving on, so I now you know what the common misconceptions are about the vaccines. I will talk now about what the dangers and social implications it may have on a child and on our community. So what are the dangers of not having vaccination? So number 1, the child is in danger and is at higher risk of acquiring a disease. Okay, so that's pretty simple. And number 2, unvaccinated children stricken with a disease may require extraordinary or specialized treatment that medical staff may not be familiar. So number 2 is kind of a tricky one. It just says like that because this type of diseases now is very uncommon here in the US. So when you bring your child with a disease, the nurses or the medical staff might not even recognize what's going on because they don't see it anymore. They might not know what the symptoms are, and they might not know what to do with your child, what health care they might need when you're bringing them into a hospital. Number 3, unvaccinated pregnant mothers are vulnerable to disease and may complicate their pregnancies. So those are the dangers of not having a child vaccinated. Now I'm gonna talk about the social implications. Okay, social implications it simply means that how it will affect our community, people around us. Number 1, unvaccinated children may need to be isolated during the occurrence of an outbreak. Okay, so let's say at school, one child suddenly develops a measles, and your child is not vaccinated, so the school will not risk your child to come to their school because your child is not immune to it. So what's going to happen is your child's going to end up missing school, and you're going to have to watch them, and it will cost money for you. You're going to stop work and everything. Okay? Number 2, unvaccinated people place others with already compromised health at a higher risk. This means that people with leukemia, cancer, their immune system is very weak, and if you don't get vaccinated, you're increasing their chances of sickness. You're gonna get them sick, because a lot of them, if they have those type of diseases, they can't get vaccinated. Okay. So those are the dangers and the social implications. Our next topic would be the benefits. So what will be the benefits of having vaccination? So number 1, individual benefits for a child is diseases that used to be common around the world, such as polio and measles, can now be prevented. Okay, so you're protecting your child from debilitating diseases such as polio. Okay, and that's very important. As a parent, that's a part of our responsibility to protect our child. Number 2, immunity protects from diseases. Okay, so that is very important for us. And number 3, children develop immunity without suffering from the actual disease. I think number 3 is the most important one, because if we vaccinate our child, they're not gonna get the full extent of the disease. Okay. So let's say your child gets in contact with another child who has a sickness. So your child might get a fever or some other minor symptoms, but she will never get the full extent of the disease, which is a very, very good advantage for her. And what is the social benefits of having our child vaccinated? Number 1, vaccination protects the health of the community. Like I said earlier, we're not just protecting ourselves if we get vaccinated, we're also protecting the people around us, especially those who are weak or sick already, like people with cancer, people of older age. So this is one way of us being a responsible citizen, get vaccinated for the protection of others. And number 2, vaccination and prevention decreases the number of hospitalizations and doctor's visit. So when our child is vaccinated, they are less likely to get sick, and less likely for us to miss work, and less likely for us to pay the hospital for hospital visits. Okay? So now that I've talked to you about the benefits, the social implications, and the dangers of vaccinations, so now you have to decide for yourselves what is best for your kids and your community. Okay? So you have to be responsible in outweighing the risk and the benefits. So you have to let every parent know of what it can and can't do. So you have to be aware that even if your child gets vaccinated, it doesn't mean that they're not going to get sick. So no vaccines is 100% effective. Okay, so that's very important. I think that's my speech for tonight. I hope that you guys learned something, and hope you have a good night. Thank you.